I'm Dr. Arun Dhir, and I wanted to thank firstly Rajendra for giving me this opportunity to come and talk to you and share my views. In my professional life, I'm a surgeon and I work at Monash Medical Center. But I have been associated with different yoga gurus and teachers in India. And my father was himself, he is in fact very closely associated with Swami Ramdev, who is a pretty well-known figure, both in India and internationally. My interest in yoga stems from the fact that I know a lot about Western medicine, and I also know about the limitations of Western medicine, which is so important to identify. And that is where I feel that this Vedic knowledge coming from the teachers of the Indian subcontinent from centuries ago is so valuable, and it is so applicable even to our today's modern day-to-day life, even though we think that we are living in the 21st century and these teachings are not really relevant, but that is not true. And we can learn so much about this. So without wasting more time, the topic of my discussion today is the diabesity epidemic. That is one of my interest areas. And I call the term diabesity is basically obesity and diabetes combined together. And this is becoming to a point where it is reaching epidemic proportions. And WHO has actually classified this as an epidemic. So medicine, I'm a surgeon, so I'm going to talk a little bit about surgery, which might bore you, but I'll try and keep it interesting. And of course, yoga, which is what our focus would be today. I will probably just briefly mention the complications of obesity, and the one that we are really focusing on today is type 2 diabetes, which is something which we are seeing is increasing in numbers, severity, and more importantly we'll see is the cost of maintaining all of this. So the complications of obesity, I'll not go too much into the details, but it affects pretty much every system in the body, starting from the top where there is a risk of strokes, myocardial infarctions, which is heart attacks, livers, lung problem, pancreas, also leads to increase in the risk of cancers, and also joint problems which impair on our usual mobility. If you're not able to see the slides, of course, I'll be detailing these, but in terms of the global trends, we are second heaviest continent in the world after the Americas, both the North and the South Americas. Just to give you an idea about it, 60% of Australian adults are overweight, 10% are morbidly obese, and 20% of our children are overweight, which is a very worrying thing because this is the next generation. And a lot of it is obviously dependent on the portion size of food, traveling in cars, less physical labor, the increased size of the burgers that are served in McDonald's, and of course the easy options of upgrading it. If you see the projections, this was an article that was published in a prominent Australian journal, and it talks about the increasing rise or the projection going from 2000 to year 2025, the solid line which goes up from 20% to almost 35% rise in morbid obesity. And when I say morbid obesity, it is basically not just being overweight, but complications of being overweight such as diabetes, high blood pressure, high cholesterol, and things like sleep apnea. So this is a worrying thing. As far as the diabetes goes, we are focusing predominantly on type 2 because type 1 is a different animal altogether. Type 2 diabetes is the problem when the pancreas is actually making insulin, which is the organ that makes insulin, but it is not enough to meet the requirements of the body, and there is resistance in the periphery. Whereas type 1, which is really the picture of that skinny kid standing in front of that sumo wrestler, is the one in which the pancreas cannot make any insulin itself, and it requires injectable insulin from a very young age. So that is the prime difference between it. But if you see, the signs of diabetes is excess thirst, frequent urination, fatigue, and frequent infections. So these are the common initial signs, and a lot of times it is not by these signs that diabetes is picked up. it is by the complications of diabetes, which is sometimes the first manifestation. And the complications can be broadly divided into the ones which are really acute, which means it can present with sudden coma if the blood glucose goes up too high or comes down too quickly, leading to death. Otherwise, the chronic complications are basically stroke, blindness of the eyes. In fact, that is one of the commonest causes now of blindness in the developed world, and kidney problems, heart problems, and leg ulcers because of poor blood supply. So broadly speaking, the complications of diabetes are the ones which affect the quality of life, which is basically, things like eye complications, kidney complications, and also nerve related complications where it leads to numbness in the hands and in the feet, or those complications which affect the quantity of life, which decide how much you are able to live, which are things like stroke, heart diseases, and other things. Just to give you an estimate, for 2012 year, which has gone by, the footprint of the estimated footprint was approximately over 4 million deaths were attributable to diabetes alone all across the world. This is a atlas which is given by International Diabetes Federation, and it's called the Diabetic Atlas, which shows the number of projections of increase in diabetes over the course of 2003 to 2025 in different continents across the world. And if you see the Indian subcontinent, which is over here, the projected rise of increase in diabetic population is 108%. And this does not apply just to the Indian subcontinent, but also to people from Indian origin, because we share the same genetic makeup. If you see the Australian subcontinent, which is there, 76% rise in the incidence of obesity is being forecasted. These are serious numbers, and they have serious implications. Diabetes, we know, is caused by excess weight, especially type 2, as I just mentioned, and we are somewhere in the middle as far as the Australian subcontinent goes in the incidence as far as men and women go. What are the risk factors? I think that is what is important in order to know what is the cause of this. Starting with, of course, previous history of heart vessel or, high blood pressure, polycystic ovary syndromes, family history, if there is a personal history of gestational diabetes or diabetes during pregnancy, that increases the risk. Whether there is, sedentary lifestyle, overweight people, especially with a body mass index of more than 25, and age more than 40 years. These are all sort of, general criteria, and you've got to identify the high risk population. The one new term that I want to just bring about over here, and there will be one key message to take from here. Can the brightness of this be increased? I think it's a little bit dark, I suspect. If it's possible. The term that I want to mention here is called metabolic syndrome. And the term metabolic syndrome really is basically excess weight around the waist. So it's the abdominal, the waist circumference, which is very important. And they say longer your waist circumference, shorter is your lifeline. Okay, so longer your waistline, shorter the lifeline. Blood cholesterol levels, blood pressure, which is high, and a fasting glucose level of more than 6.1 is considered to be a syndrome which is called metabolic syndrome. So you need not be having any actual diagnosed or manifested blood problems or medical problems, but if these three are there, that means you have a metabolic syndrome. And this is something to understand. And one of the risk factors, very important risk factors, we might think that, oh look, we eat more sugar, we'll get diabetes. That is not true. I'm not saying that you just go and start, full on sugars, but the most important cause is stress. Stress leads to a state in the body which generates hormones which actually increase the blood glucose level. It's like a fight or flight response, as you would have heard from many people. If there is a stressful situation, that leads to an immediate release of hormones in the body, so that the blood glucose increases, and that provides glucose to the brain, because brain only uses glucose and nothing else. And that is what prepares the body to face that stress. Now, if that stress happens at one particular moment and goes away, that's fine. The hormones go up and the body then adjusts the glucose, and then again it comes back to normal. But if that stress perpetually remains up, then it leads to permanent changes. Even though you may say that, I don't take any sugar, or I'm sort of, fairly normal weight, but the stress is something that will perpetuate the high sugar levels, putting more strain on the pancreas, leading to burnout of the cells which actually make insulin. So this is something which is very important to understand, and this is exactly what I just told you. One-time episode, acute event gets controlled, but the long-term event starts having then permanent damage. So stress and diabetes, mostly I would say anxiety and depression. This is data that has been published by Diabetes Australia, which is an organization that provides education to the community about diabetes, that having anxiety and depression doubles the risk of developing diabetes. Type A personalities, smoking and alcohol, lack of adequate sleep, and emotional lability are also very important factors in poor control of diabetes. So essentially, the epidemic of diabetes is, associated with soaring costs, shorter life expectancy, and also poorer quality of life. As far as the management goes, I'm not going to go into the details of it, but briefly I'll touch upon the job that I do, which is surgery, and not everyone requires surgery. I must make it very clear over here. Surgery for diabetes, what is the role? I think the key thing that I need to highlight here is, this is exciting stuff, but the problem is that people who have got a BMI, and body mass index is what we actually use as a guide. BMI more than 35, there is really not much in terms of medical management that can be done to actually treat these people. Because unless they lose their weight, which is BMI of 30, normal BMI is 20 to 25. So if the BMI is above 35 and if they've got medical problems, they really need something radical so that can actually change how the body is doing things, and which is why medical therapy is very limited in success. And this study over here, or this graph, and I'll not sort of go too much into the detail, clearly highlights medicine or drugs, exercise, diet in different forms. This is basically the percentage of weight loss which is being shown in the graph, and surgery is right on the top. So if you see the years of follow-up, if you followed these patients, or these patients were followed up for 8 years, all the patients who had just diet, exercise, or just some drugs or medications in various combinations initially lost some weight, which led to improvement in their overall health status, but then their weight slowly came back as these patients were followed up. The only long-term sustainable result in that BMI category above 35 was with surgery alone. And really what we are trying to do is, we are trying, using this surgery, to bring these BMI of 35, 40, or even 50, more than that, to bring them back into the normal weight category, which is, of course, radical, but these are the 3 different procedures that we do. I'll not go into the details of this, but just to name them, the one over on the extreme left is the lap band, the one in the middle is called a sleeve gastrectomy, and the last one is called a gastric bypass. But the only one that I want to highlight as far as diabetes goes is the gastric bypass, which has got fantastic results on treating not just obesity, but the type 2 diabetes. And there has been a lot of literature on this, on what is the efficacy, which means how effective is this gastric bypass in treating diabetes. What I just want to show over here is, this is the graph of one of our patients who recently came and saw me. She had her surgery in October last year. And this is basically a graph, or we call it the blood glucose chart of the patient, which gives you a snapshot of the previous 12 months of glucose control. It is generated by the glucometer itself, so AccuCheck glucometer is what was being used. In October, where that arrow is, prior to that, you can see her blood glucose levels were sort of, really haywire, up and down, completely. Sometimes she was on 100 to 125 units of insulin, which is like, constantly jabbing yourself because the blood glucose were not controlled. And after the surgery, you can see the immediate impact. And she's been under regular follow-up with us now for almost 9 months. And this is just one patient that I'm just talking about. But essentially, the stabilization of the blood glucose was the key thing. And she's currently off all medications for her diabetes. That was the more important thing that we were looking after. So I think that is as much as the surgical or the medical knowledge as far as the background of diabetes goes. Today I want to address you as far as the yoga and the treatment for diabetes goes. And once again, I thank Rajendra for this opportunity. I'm a certified yoga teacher with Yoga Australia. So that is my disclosure, and I owe any knowledge or any ability that I have to my teachers, Srila Prabhupada, who taught us Bhakti Yoga, and Sri BKS Iyengarji, who gave us the science of yoga, who all of you would be familiar with. As far as yoga goes, and this is where I was saying that, in Western medicine, sometimes I feel or I get an impression that we are only treating the superficial symptoms. We're not treating the root cause of the problem. The thing is that if someone's sugar is high, you give insulin. What happens next? If the sugar goes too down, then you give sugar, as in glucose. So, you're just treating things at the superficial level. Why is this happening? We really don't have any drug, any medication in the Western medicine to do it. But maybe, and look, I think I'm very convinced about it, yoga and its teachings are very convincing that this can bring about a radical change in our lifestyles if we are committed to it and if we take it seriously. And as you all know, it is actually called Ashtanga Yoga, which means it's got 8 different limbs. But the 3 key aspects of yoga which have got a positive impact even on diabetes management is, number 1, asanas. Yoga is not just about complex bodily postures. It is about optimizing the function of the body. Asanas optimize the function of the body organs. Pranayama, which is breath control exercise, optimizes oxygen supply to the organs so that they continue to function. And Dhyan, which is meditation, optimizes the mental state so that it counteracts any psychological factors. And as I told you, stress is a very important factor in all these chronic non-communicable diseases that we are seeing more and more of. The other, I should say, limbs or arms of yoga to complete the, I should say, Ashtanga or the 8 limbs is Yam, which is resistance to passion. Niyam, which means following the rules. Pratyahar, which means resistance to sense gratification or giving into the senses. Dharana, which is concentration, our ability to keep our thoughts focused. And the last stage is Samadhi, union with the Supreme. Now, just a quick question, and I'm sure this would be known to most of you. What does yoga mean? What is the meaning of yoga? It is the union, exactly. So the union is, it's not just complex physical exercise only. So it should not be viewed as just a physical exercise as we are going to a gym or to a fitness center to achieve some level of fitness. Yoga is overall development which leads or promotes us to connect to that higher source of energy, the powerhouse, so that we get rid of all the negativism or the negative energy and imbibe the positive values. And that is something very important. This is basically just going back. This was one study, sorry about again the poor light, but this was one study which was published in the Journal of the Association of Physicians of India, which gave a pretty good outline of they recruited patients, and on one arm they had patients who were only treated by, the diabetic patients were treated only by drugs, which is insulin or tablets, and on the other side they were treated with drugs and yoga. So yoga was the only differentiating factor between the two, and they had some pretty impressive results, I should say. And what they found was, in this study, was patients who had yoga and were on diabetic medications had reduced requirement of medications because of improved glucose tolerance and more insulin sensitivity. So the body's own insulin production was sufficient. It was creating enough insulin to create sensitivity. The more important thing was there was reduced waist circumference, their cholesterol levels improved, and more importantly, the body fat content went down, and there was increase in the muscle content, which is again important for maintaining the blood glucose levels and reducing the, I should say, requirement on insulin. Lastly, the yogic concept of diet. As we eat, so shall we become. It's a very important saying. Food has got a very, I should say, important and a significant impact on the mind. I would say over here that sattvic food calms and creates a lot of balance in the mind. Rajasic food, which is very sweet, very chilly, very spicy, creates a lot of excitement or passion. And food in the mode of ignorance, which is tamasic mood, creates makes our mind dull, and it makes us lazy. So these are the things which are different qualities of food, which is important to understand. I am a very strong believer and a proponent of vegetarianism. Amrita, do you mind just giving me those two books? I just wanted to show it to the audience. I'm a very strong believer in vegetarian diet, and I'll just show you some evidence as well. The key thing from a scientific perspective is, thank you, is that the high fiber content reduces the cholesterol. It also increases the insulin sensitivity, and non-violence to higher forms of life for self-maintenance is really what the definition of ahimsa or non-violence is. We eat to live and not live to eat. This is a snapshot of a Medical Journal of Australia supplement, which was an exclusive, I should say, article published by a non-religious organization on adequacy of a vegetarian diet in our modern day society. We think we need to have meat, we need to have eggs because we need our protein, otherwise we are going to disappear. Okay, we need that because otherwise we are going to be very low on iron. Okay, this issue, and I've got a copy of this, I scan it and I can email it to whoever wants it, published by Medical Journal of Australia. The key question was, is a vegetarian diet adequate? So any one of you who's got any doubts that vegetarian diet is not sufficient or it's not healthy enough, I can forward this to you, convincing evidence on each and every aspect they have investigated, and they have come up that protein quality in a vegetarian diet is actually much better than the quality of protein that you get in a meat-based diet. I also share this book, which is called Higher Taste, with the yoga students who come to my class. This is a book which gives a very good snapshot in the first half on what is the rationale for a vegetarian diet, and on the second half of the book there are lots of interesting vegetarian recipes. So you could get a copy of this. And look, I would probably end my presentation over here with the note that I'm really encouraged and enthused to see such a committed and a fantastic audience. Once again, Rajendra, I thank you for the opportunity to come and share my thoughts with your audience here. And I feel very strongly that it has to be a multi-pronged approach. Please don't get me wrong, I'm not a critic of Western medicine, that is my profession, but I feel that it has to be complemented by the principles and the knowledge that is there as far as the yoga and the Vedic principles have taught us. So we have got a lot to contribute, especially people of Indian origin have got a lot to contribute to the community here, because let's not forget, if we are not well, or if we are not able then we are going to be dependent on the society. And if you're dependent on the society, then you are not really able to contribute anything to the society. You are actually a burden or a liability. So the health of the nation starts with the health of the individual, health of the family, health of the street or the suburb, and then going on to the nation. So I think these are very key, important factors that we need to understand and share with others. And with that, I might just, put a rest to my presentation. I know Rajendra asked me to take a yoga class as well, which I'm happy to. And that's what we would be doing. Focus being on, of course, obesity and diabetes. So any questions I can take, otherwise we'll get started with our yoga class.
If you are vegetarian and also going yoga and doing all that, but you've got a family history of parenting and diabetes, what are the percentage of the person being diabetes?
See, there are a lot of factors which which are partly under our control and partly not under our control. So when I say partly not under our control, I'm really referring to our genetic makeup. Every individual has got his or her own genetic makeup. The factors that you can control in your which are in your hands are A, healthy diet, B, I should say, making sure that you get enough exercise. That is very important part of preventing diabetes. And the third thing is preventing weight gain. One of the key things that I attended a presentation recently, and you were there as well. Can you believe, and this is a health tip that I took, taking yogurt or dahi as we call it commonly in India at night time actually is so unhealthy based on the principles of Ayurveda and naturopathy. Taking dahi or yogurt at night time actually over a prolonged period of time can increase your risk of developing diabetes because it is not processed the way it should be processed during by the body. So this is, again, I'm not a naturopath or an Ayurvedic teacher, but I was at a presentation recently where you were as well. And there was very clear evidence provided that our diet has got such an important role in actually deciding how healthy we are, how we think, and how long we live. So it is very important. And I also am a believer that most of these chronic problems, they start if you have an upset gastrointestinal tract, if you're not, regular with your, I should say, bowel movements and all that. It can lead to long-term problems. So that is something which is very important, and the most effective thing that I found over there is taking 2 or 3 glasses of lukewarm water in the morning before you do anything else is a very effective bowel regulator. So I think these are small tips. It is actually small steps that take you to your eventual goal. So it's not really a quick solution that we have. But in answer to your question, there are factors that are in your hands and there are factors which are not in your hands. So you've got to focus on the factors that you can control.
When you say the stress hormones, what hormones are you talking about?
So we're talking about a variety of hormones. The body's stress response, one of the common ones that you would have heard is adrenaline, glucocorticoids. So these are just some of the hormones. There are a variety of hormones that are produced in the body, and the aim of all these hormones is self-preservation. So these are called fight or flight hormones. That is, anytime we are in a stressful situation, the body goes into a mode of preserving itself and providing nutrition to the most vital parts of the body, like the heart rate goes up, the brain becomes very sharp, and you want to just make sure that you avoid any, any untoward thing. You are really concentrated on trying to address that problem only. So this is a stress response. The blood moves away from your gastrointestinal tract. So those are the things that the body undergoes in a stressful situation. These happen reflexively. It's not that you've got a control on it. This is just something which is a reflex response.
My GP says that if I am a vegetarian, I will remain low in iron. And they say that
Well, I can only say to that that I have been a vegetarian for the last 20 years and I've been getting my blood tests done regularly. I think you need to just focus on the right kind of diet. Spinach is a very good source of iron, everyone will say. And again, if you're not convinced, I can send you that article, but you can always take an iron supplement. There's nothing wrong with that. You're not killing anyone to get an iron supplement that way. All right.
That's a question.
Yes.
So, as people from the Indian subcontinent, we rely a lot on rice and grains, wheat for diet. I suspect that contributes to the high percentage in the Indian subcontinent. I mean, I've been told by an endocrinologist eating too much rice increases your risk and everything. I mean, is it true?
Possibly. Look, as I said, I confess I'm not a naturopath, but what I believe in is that food eaten on different times of the day has got different impact as well. Generally speaking, white things such as rice or yogurt should not be consumed after it is dark. And that's sort of a general principle that I follow. All right. So, Rajendra, I might start with the yogurt. Is that?
Yes, one more.
Sure.